Hi, I'm Dr. David Warwick, Lacey, Olympia, Washington chiropractor, and we have Deanna, who is involved in a motor vehicle collision, and I'm going to demonstrate what I do with some of our motor vehicle collision patients when they have that and other injuries. She's also very athletic. She does a lot of the CrossFit type work. And what's some of the other work that you're doing?
Running, rugby, I was in that for a bit, and just sustainable injuries. Pretty much competitional stuff is coming up, competitions.
So she competes a lot, and we were just talking before I actually started the camera, how much she's noticed improvement and how she has to change and relearn, well, not exactly relearn, but has to develop strengths in other areas, and she's seen some improvements. So all right, so we're going to begin. We're going to check with the leg length. And since the collision, one of the things I noticed that her legs there was quite a bit of imbalance in the legs, where one was shorter than the other. So some chiropractors use that to look at and see how much stress is going on the spine and the body and the extremities. Today, so the right leg is only about a 1/4 inch short. So that tells me that I'm seeing a lot of improvement compared to when you first came in. All right, so we're going to begin checking. I'm going to check with the knees because I know we briefly talked about the knee area. So I'm going to pressure test some of the knees and see where that misalignment is. So I have right on the area right here on the right knee. We're going to adjust that. Did you say you were having more pain on the left one?
Left lateral.
Okay.
Yes.
Stress here. So your right leg went about 3/4 inch short. I'm going to bring it into this correction motion. There it is. We're going to come right into the joint space, use our instrument to adjust. I'm going to pressure test the fibula right there. So I'm going to roll the knee just slightly this way. You okay with that?
Mm-hmm.
Okay. Okay, so what I'm going to do, I'm going to go throughout the rest of the spine and check up there. So what I want you to do, put your right hand on your lower back for me. And we have L5. Back down. Now we're checking with these isolation movements. We check to see what direction the misalignments are in the spine. So when I brought her legs all the way up like that, it was showing misalignment at L5, but the vertebrae was sitting in an up position. All right, left hand lower back. That stays even, so back down. That's the first time that I've seen you holding that adjustment, so that's good. Both hands on the lower back. And that's for L4. Now we're at L2. Hands down. So we have L2 on the right, and then sitting what we call up or in a superior position. Right arm above your head. Both arms up there. So we check T12, T8. Nope, looks good. Hands down, turn your head to the right. Keep that there. Raise your right shoulder, back down. Okay, that's definitely more motion to the right. Remember the first day you came in, you weren't even able to turn your head like that.
Mm-hmm.
Okay, T4 with T4 rib. Shrug both shoulders. Good. Shrug and roll them backward. Okay. And then put your arms by your sides. Squeeze your right elbow into your side. So we're checking the shoulders. Relax it. We're going to adjust the scapula. Good. Left elbow into your side. And relax. Head back to the middle. That's C7. C7 looks good. All right, lift your head up for me. Back down. Definite improvement from when you came in.
Mm-hmm.
Tuck your chin to your chest and relax. So we're testing C1 And we're going to be adjusting the atlas, the top bone in the neck. This is where people get a lot of their neck and head pain and headaches from. This bone can misalign in 21 different directions, so a chiropractor could be looking for and adjusting in 21 different ways when they make their assessments on there to make sure that bone is functioning properly throughout the neck. Push your head into the table, relax, turn your head to the right, push your left ear into the table, relax it back to the middle, and go to the left, push your right ear into the table, and relax. Okay, back to the middle. So I'm just gonna feel, and do you feel it right on the side right here? Do you feel it, anything up here?
Only when you press on it.
Only? Okay. So I'm gonna bend the leg. We're gonna do a nice little traction here. Are you okay? And then we want to check side to side as well. And then we're going to start doing a nice gentle traction throughout her spine just to help the joints. It's more of a what we call a joint mobilization where we can feel, or I can feel, if the joints are still functioning and moving, but it helps stretch some of the lower back. And I'm going to bring this down. You doing okay? There we go. Okay. I want you to push your knees into the table for me and relax. And we check this psoas there. Squeeze your knees together this time. Relax. Now we're checking the part of the pelvis called the pubic bone. And actually that part of the area is still part of the pelvis. It still has a disc in between the joints, right in the front area, right through here. So her right leg went short in that position. And you can see even, I don't know if the camera can pick this up, but the right leg's longer in the second position. So yeah, Dee, let's have you lay on your back for me. So a lot of times people get low back pain and the pubic symphysis or the pubic bone, which is actually two sections, can refer pain around. So I'm going to place my my hand on the right side, the top portion of the pubic bone. You'll feel me right at the top here, maybe a little sensitive. I'm going to use the instrument to adjust right there. And one of the things that you can do, this is what I want you to do at home, just that. It helps drop that pubic bone into the downward position on there and takes stress off it. You can lay like that for, 5 minutes when you're watching TV or something, or you're stretching. Just at the end, that'll help rock that back and get this pelvis to also move. Let's have you go back, face down again. Now we're going to do some muscle testing and recheck the lower back and make sure all those nerves are working, especially down to the knee, because a lot of times when people have problems in the hip, the knees, or even the ankles or feet, we find it first coming from the spine first. And the same goes for in their upper arms, noticing it comes from the neck or the upper mid-back. So bend this knee for me. And I want you to hold it in that position. And as I push on certain areas, just keep holding and resisting me. Good. So we're at 5, 4, 3, 2, 1. Okay, let's do it with the other one now. Let's see if you're strong enough there. Hold. So I'm going to push on the S. You're okay? Okay, 5, 4, 3, 2, 1. Okay, good. Was that painful or was that less
It
painful?
was a little bit tender on the outer side right there, but it wasn't like unbearable. It was like, oh, that's a new,
Okay.
like, that's a new thing there.
So now we're just going to come back to that and see if I missed anything. And I'm pushing more in the direction of correction or in misalignment. So come right into that joint space right there. We're going to push this forward. Nothing there, nothing in the femur, nothing there. Here. I'm going to put a little bit of twist into it, see if there's something that she did. No changes there. Okay, let's have you on your back one more time, and then we'll call that. So I'm going to check the feet in this position. So I'm going to check all of the bones in the feet. There we go. Talus bone. A lot of times people will feel pain in the knee, and it could be coming from the lower back, or it could be coming from the foot as well. Did you say you had a foot injury?
Yeah, I sprained
this
that
one?
one about a month and a half ago, and the rotation is still
Right here.
Yeah,
Yeah.
that and dorsiflexion, plantar flexion too is a bit of a.
There it is. So the old
Everyone's
injuries
like,
too, chiropractor's very successful in working with that. Sometimes those bones get locked up and out of place,
Oh, yeah.
and then people just learn to live with it. And so your body adapts to those misaligned positions, and you can hear as she kind of said, oh yeah, that hasn't been moving in a long time. So she's going to feel a whole different movement and gait when that area is functioning better.
I can actually get up on the pull-up bars now.
Yeah, you feel the movement here now?
Yeah, that's so bad, yes.
All right. You happy with that?
I am perfect with that.
There you
That's
go,
great.
folks. Dr. David Warwick, Warwick Chiropractic.